Okay, welcome everybody. I'm Marcus Cheatham from the Mid-Michigan District Health Department. Um, you're all doing a wonderful job of keeping muted. So consequently, I don't know if you're hearing me. So I'm going to call on Dan Manley. Dan, if you would unmute and say good morning to me.
Good morning, Marcus.
Good, I can hear you. Okay, we're in business. This is a call about the imminent arrival of the Moderna vaccine in mid-Michigan that we're all so excited about. And I wrote in my notes that the first thing I was supposed to say is that it's here, but it's not here. We were told we would get an email last night telling us where and when it would be delivered. And I've been emailing the person who directs our vaccine program about every 15 minutes. Have you heard anything? Have you heard anything? And she hasn't heard anything, but we do know for sure that it's on the way. And I just want to start by editorializing a little bit and telling everybody, you read so much in the media about the media's understanding of what's gone well and what's gone badly. And I'm not talking about sort of the crazy federal leadership here, but just talking about the boots on the ground, public health, the people at CDC who actually make vaccine and put it on airplanes and send it out. This production and distribution of this vaccine has gone about as well as one could have hoped for, in spite of some of the fireworks you've seen, Michigan getting less than we thought, and so on. All of the mistakes that I think we've seen are within normal operating parameters. They're within reasonable margins of error. We really thought we'd be getting this vaccine right about now. And sure enough, here it is. And of course, the flow is starting out very small and getting bigger. It's still much bigger right now than we thought it would be. We're expecting it to come faster than we had, we were being conservative in our hopes, and we think it's coming faster than that. So that's all very good. So a couple things I want to say. Let me start by just talking about what I hope we accomplish while we're sharing here today. I want you guys to understand the logic of the rollout. It makes really good sense from an epidemiologic point of view. I want you to understand the logistical challenges that we're all facing. This is as you've heard, an unprecedented event in American history. And we're going to be accomplishing things in the next 6 months we've never done before. I want you to be able to understand just the basics of what the plan is, because your health department is overwhelmed and we can't answer all the questions that people have. So we're hoping you will serve as ambassadors for us and answer your staff's questions, community questions, and of course, always refer them on to us if you can't. But I think probably most of the people on this call actually already know as much as I do about what's going on, because you're smart people, you pay attention, and that's the best that can be said of me too. And then time permitting, toward the end of this call, I do want to have a conversation about how we can respond together. The health department needs some help. And so want to have an open-ended conversation about that. But as always, since I am a wonk, I want to start by looking at some data. That's my favorite thing to do. And it really does help explain what's going on with the response here. So here we go. All right, it's not going to go. So we'll just do this manually. I'll give it one more try. No, okay. Some of the actions won't happen on these slides as a result. What I'm showing you on the screen now is our 3 counties with cases per day. Your health department has a much better slide of cases than this one. This is from the My Safe Start website, where schools and courts and other people go to get information about whether it's safe to be open or not. And so we have Clinton County with the blue dots, Gratiot County with the green squares, and Montcalm with the light green triangles. And so basically you can see that we had very few cases. So again, this is cases per day per million, and that's so that we can compare the 3 counties and see how bad it is to be a person walking around downtown somewhere in one of the little towns or villages, and makes them comparable. Obviously, we'd have a lot fewer cases in Gratiot because it's so small compared to, say, Clinton County, a lot more people. So that's why we turned it into a rate of cases per day per million through most of the summer. This only goes back to September, but through most of the summer, we had very few cases. We thought we had a lot of cases, but we didn't have a lot of cases. And then when we got into November, we suddenly just got bombed with an incredible number of cases. We were having over, at your health department, we were receiving information about 200 cases per day. To do the case investigation and contact tracing, we used our federal COVID money and went on a hiring spree, and we still couldn't keep up with it. We have volunteers working with us. We still couldn't keep up with it. We had a ton of cases. And so what I'm telling you now is finally toward the end of November, that started to come back down. So thank goodness. We're still having about 100 cases a day here, but this trend is coming back down. I highlighted the past 2 weeks here in yellow because the state epidemiologist tells us she does not think the data are up to date for the previous 2 weeks. So we know, for example, we are not down to 0 cases. I just got off a call with my nurses, half an hour ago, and they said, no, it's still really bad. So data's flowing into the system very, very slowly, simply because there's been, 1,000% increase in cases flowing into the Michigan disease surveillance system. So it is bogged down, it's overwhelmed. It takes a lot of time to get information up to date. But the state epidemiologist tells us, no, this downward trend is real. The cases are starting to decline. And obviously the state attributes that to the pause to save lives, putting things on hold, keeping, for example, restaurants closed to indoor food service and things like that. They believe that it's had the desired effect. That's very important. And the reason that's very important is because now I'm showing you deaths in our jurisdiction, and quickly glance to the right of the chart and you'll see the deaths are not coming down. In fact, right now we're having an unprecedented level of deaths. So looking back to September again, looking along here, there were large periods of time when we were not having deaths in our counties, thank goodness. We really didn't have many deaths at all until recently, which was great for us. We didn't experience the awful mortality that they did in Southeast Michigan, but it also made some people think that COVID's not a big deal. It doesn't kill people. Why are we having stay-at-home orders and things like that? And unfortunately, it fed sort of the resistance to safety because people didn't believe it was a problem. The chickens have come home to roost. Since November, our deaths have really soared. Looking over here on the scale, you see we have 1 death and 2 deaths. So looking at, our counties, adding that up, 1, 2, and 2, or 1 and 1 and 2, or something like that. Well, Marcus, we're only having 4 or 5 deaths a day. that's still not a really big deal, is it? It's a huge deal, and here's why. For our 3 counties, in a typical year, we have about 1,700 deaths in a typical year, which is about 4.5, almost exactly 4.5 deaths a day. And right now we're having almost exactly 4.5 deaths a day. So right now we have doubled the rate of funerals in our county. We've had about 150 deaths in total so far due to COVID, which is not huge, but the deaths are continuing at the rate of about 4 or 5 deaths a day. So projecting out into the future, we could have somewhere between 200, if these deaths come down soon because the cases are coming down, or if this trend continues, 400 deaths. We only have 400 deaths a year in our 3 counties from cancer. We only have 400 deaths a year in our counties from heart disease. If we have 400 deaths from COVID, that's like doubling our cancer rate or doubling our heart disease rate. That's horrible. You know, the death data, the numbers are small because we're small. So we're really experiencing actually higher rates of mortality right now in mid-Michigan than anywhere else in the state of Michigan, except in the UP. Yes, the rural UP, even more rural than us, is having higher rates of death right now than us. But we are the COVID mortality hotspot right now, and we need to make that go away. So if these cases keep coming down, that will help make it go away. But the other thing that will help make it go away is if we can get that vaccine coming. And so I'm going to talk now about the vaccine and what we can expect from that. Before I go there, I just want to remember, I want to ask you guys, we know a lot of people in our area are resistant to the idea of getting the vaccine, but I want you to be vaccine evangelists for us in the following way. If you're talking to an otherwise healthy young person who says they're not going to get it, you might want to save your breath and not argue with them. But if you're talking to someone who's vulnerable to this disease, an older person, somebody over 65, somebody who has a pre-existing condition, please personally ask them, put your hand on their shoulder and say, I really want you to get this vaccine. It could save your life. It really could. So help me with that, please. So we know there's 2 vaccines coming, the Pfizer vaccine, the one that has to be stored in ultra cold refrigerators, and Moderna. I fought like crazy to get super cold refrigerators in our jurisdiction so we could get that Pfizer vaccine. I'm so glad I failed at that and we didn't get it. The Pfizer vaccine, we only got a little bit of it, and it didn't come anywhere in mid-Michigan anyway. Our hospitals didn't distribute it to the small rural hospitals, and so it never came, wouldn't have mattered. And the Moderna vaccine is going to arrive today or tomorrow to all of our hospitals and to your health department. And it is much easier to handle. Any competent vaccine practitioner can keep it cold in their ordinary freezers. Thawing it out and using it is not a big deal. So a couple things about this vaccine. It is very, very safe. It's crazy safe compared to most other vaccines. We know this because it was thoroughly tested. You hear that it has not been thoroughly tested. That's just not true. It went through complete clinical trials, just like any other vaccine. It does have side effects. It does make your arm hurt. It can cause fever. Those are the normal side effects of a vaccine. They are not COVID. You cannot get COVID from this vaccine. It's not a live vaccine. It also doesn't actually go into your cells. It cannot reprogram your DNA or anything like that. It's very, very safe. It does its magic from outside. And all it really does is ask your cells to make antibodies to COVID, and it is super effective. And that's really important. A lot of vaccines don't work by protecting you, by making your body immune. They make herd immunity. and you get protected because the other people around you have a little bit of protection. But this vaccine actually makes your body very resistant. And this is important because if we don't attain herd immunity and you get vaccinated, you'll still be 95% protected. And if you do get it, you'll almost certainly get a mild case. So that's what a deal. That's amazing. When we talk about the consequences of not attaining herd immunity, that means the other unvaccinated people will continue to get severe COVID and continue to die from it. But if you get vaccinated, you won't. So get vaccinated and tell vulnerable people to get vaccinated. Okay, you will need 2 shots, as you've already heard. For the Moderna, it's 28 days apart. It's really important to get both shots. You have less than 50% protection if you only get the one. That's a heck of a lot better than no protection. So, but to have that 95% efficacy, you should get the second shot. You might not have any side effects. You might not have a sore arm the first time and then have it the second time. That's one of the bad news. You can't tell from the first one what the second one is going to feel like for you personally. You cannot get it early. You will have lower protection if you get it earlier than the 28th day. You can totally, absolutely get it late. If you can't make it on the 28th day, but you can on the 40th day or the 60th day or whenever, go back and get that second shot. There's a lot of different places you might be vaccinated, and we'll be talking about that in a minute. You'll almost certainly receive a text reminder from wherever you go, probably from the Michigan Care Improvement Registry, to remind you to come back. You don't have to worry about there not being vaccine for you for the second shot. The CDC is automatically rolling these things out in pairs, exactly 28 days apart. So your vaccine will be there, and your health department doesn't have to remember to place those orders or anything. That will happen automatically. Pretty much everything else about the vaccine is unknown. And that means if you've already had COVID, we don't know whether that confers enough immunity on you. So everybody's being told, even if you've already had it, get vaccinated. Why? Because we don't know. We're encouraging people to keep masking initially and doing things like that, because there's still a lot we don't know about whether people are contagious and things like that. I think a lot of those fears are almost certainly overblown. And one may well ask, if I can't go back to normal, what's the point of getting the vaccine? Remember, it can save your life. But they're recommending that people continue COVID safety precautions for now, just because of all the things we don't know yet, because the only thing we've studied is whether it works and whether it's safe. They haven't had time to study anything else about this. Most likely for the rest of our lives, we will periodically have to have COVID booster shots. Every 3 years, every 5 years, we don't know. We already have to do that for so many other vaccines, and this one will probably go on the list, and you'll probably start getting reminders from your provider to come get your COVID booster, just like you do for everything else. And that'll probably be our lives going into the future. As of last night, 500,000 people in the United States have been vaccinated. By the end of today, it'll probably be 1 million. We're building up from there. They say by the end of February, it'll be 100 million. I would like it to be much more like 200 million by the end of February, and that might possibly happen. In our jurisdiction, we have 180,000 people. Hospitals, the National Guard, your health department, there's going to be many others. Your private physicians will be doing COVID vaccinations. The health department's share of 180,000 people is probably 50,000 people. And if we spread that out over 4 months, that means we have to do about 400 people a day, day in, day out, including weekends, every day for 4 months to get our 50,000 people done. So that is an amazing heavy lift for us. We're a small rural health department. We only had 4 or 5 nurses who could do vaccinations when this thing started. We've added nurses now, and we're still going to need volunteers to help us do 400 a day. Right now, when the Moderna starts arriving, we're going to be getting about 800 doses per week. That means that's way short. We need to get up to about 3,000 doses per week coming into us to do that 400 a day. But that's the logistics of this. And we think by the middle of January, we will be getting about 3,000 a week, 800 doses a day coming into us. Okay. I want to turn my attention now to how the vaccinations will roll out, the specific details. This slide was supposed to light up to show you the different parts I wanted you to look at. That's not working now. It's all lit up, but I think you can still see it clearly. So we're going to roll out in 3 groups. 1A, 1B, and 1C. So this is group 1A, 1B, 1C. Group 2 is everybody else not listed on this slide. But notice how they put everybody who needs to be vaccinated right away in group 1, right? We all want to be able to say we're in group 1. So they shoved everybody except our teenagers and college students into group 1. And so we all get to be part of group 1. So right now, we're looking at group 1A, tier 1A, priority 1, and that is your vaccinators, the people who are giving shots to people. Obviously, they need to be vaccinated themselves, and emergency medical personnel, first responders. We are starting to do them now. As soon as we unpack our Moderna, we are starting to do that, and some of you on this call have already been contacted because you're a first responder and told how you're going to be part of that, and you might even be tasked with participating in the vaccination. You already know who you are. Okay, so when we come back from Christmas, immediately we shift our attention to 1A priority 2. So we'll be doing those folks in early January, and that is long-term care facilities, staff, and residents. And that is specifically to stop COVID-related mortality. Nearly 40% of the COVID deaths have happened to people in long-term care. So they're going to zoom right in on that and vaccinate those people first to stop the mortality coming from that group. Then we get to 1B starting in late January, and those are essential workers. And many of you on this call are essential workers. So if you squint your eyes and look at this slide closely, you can see that that includes school personnel. It also includes childcare staff. If you look down here at the bottom, it also includes people who work in homeless shelters, Jake, and also corrections personnel, because so many cases have happened in prisons. So excuse me, but last night we were notified that the American Committee on Immunizations Practices, last night, after I had prepared these slides, voted to change some of the recommendations. And this is how it's going to go all the way along. We were going to keep people over 65 until 1Cs down here at the bottom. They moved the 75s and over up to 1B because of the high rate of mortality in people over 75. So that was actually a good decision. It makes my slide and our planning confusing, but it was a very good decision. To do that and to have enough vaccine for everybody, they had to move some of these essential workers down into the 1Cs. So the 1Cs now are people 65 and over, including those over 75 who got missed in early January. But it also, some of the essential workers have been moved down to 1C. And we think it's probably the people in the second bullet point here. Unfortunately, So that could include you. So some infrastructure workers, government workers, people like that, they're probably keeping transportation and retail up here in 1B, but moving the rest of them down to 1C. So some of you who on Sunday morning, we're going to be in 1B, we're going to be vaccinated in late January. We think they've moved you down to February. To make it more confusing, and I'm sorry about this, but I'm just letting you know what we're dealing with. The American Committee on Immunization Practices made recommendations, which probably made sense in terms of reducing mortality, but then said, these are just recommendations, and we're leaving it up to the states to work out the final details. Since this happened last night, I don't have the final details. I'm not sure about which essential workers have been moved down here. The state obviously has not had time since last night to think through all of those details. So basically the plan is to keep it simple: emergency medical now, long-term care early January, over 75, and some essential workers late January, and then we'll see about the rest after that. So that's the simple plan. You should have received a version of this. We sent out a second email reminding you of this, and it should be there. Otherwise, it'll be on the health department's website. Also, since last night, it's wrong. So you might as well wait for the final one. The last thing I'll say, and then I'll shut up, is the health department's proceeding in the final way. We're up here in 1A, priority 1, medical first responders, right? And we have 3 counties, Clinton, Gratiot, and Montcalm. We're taking them in order. Clinton County on December 28th, that's Monday, the Monday after Christmas. Gratiot County on December 29th, the Tuesday after Christmas. And Montcalm on December 30th, the Wednesday after Christmas. And emergency medical people are receiving invitations to come and be vaccinated. In Clinton County and Montcalm County, some emergency medical personnel are being done by hospitals, or they're doing themselves. And you know who you are, so we won't share that with the whole world. These clinics that we're doing are what you call closed pods. That means we have a list of names, and the people whose names are on the list have been invited because they're an ambulance service, or they do high-risk medical procedures at a hospital or something, and they're coming and getting vaccinated. They know who they are when they arrive. We'll check their name off the list. So don't try to crash the party in December. You'll be invited in January, hopefully, if you qualify soon. We are growing our list as we go along. We are inviting folks, for example, mental health providers. If you are a mental health provider, and so these are people in mental health who are clinicians, who see patients face to face, we're inviting them. If you haven't received an invitation, the reason is we're growing our list. We're inviting people, because remember, we only got 800 coming, and we'll have 800 coming again next week, so we can't exceed our capacity. So we're working our way down the list and inviting people, and we're building our list up, and we're only inviting people if we know we have vaccine for you. Also on our website, so we'll go there now, Mid-Michigan District Health Department.org or MMDHD.org. You can also just Google Clinton County Health Department, Gratiot County Health Department, Montcalm County Health Department. It knows what you meant. And then click on the COVID picture. And at the top of the list there, you will see a form you can click on to fill out to say, hey, I want to be vaccinated. And you can let us know, and we will put your name on the list, and then we'll sort it by the priority groups, and we will invite you to come. So please go ahead and do that. That's what I had to say to start this meeting. I would love to open it up for questions and comments right now.
Marcus, you do have a question from Linda Bader. She says, I think I missed, when do we expect 1C to start being vaccinated? And maybe you've explained that.
Yeah, so 1Cs will be in February. And again, this is very tentative. And I think I probably violated the rule about, tell them it'll come in March and then they'll be happy when it comes in February. And I'm giving you sort of, I'm telling you what the Michigan Department of Health and Human Services is saying they want to have happen. So for example, many of the long-term care facilities will be vaccinated by pharmacies or the National Guard. And I was on a call with some of the pharmacies who were saying we've been scheduling long-term care facilities, including all the way out to late January. And the Department of Health and Human Services went crazy and said, no, you're going to vaccinate those people in the first 2 weeks of January. Schedule them and go do it. They said late January is for 1Bs. Okay, so they're really pushing to get this out as quickly as possible. So their schedule is long-term cares will be done in early January, essential workers in late January, and then we'll move to high-risk folks in February. So that's what we're hoping will have happen.
Marcus, this is Lily Petricevich from Sheridan Hospital. Hi. Question that I have is, you said that hospitals have been notified already who's going to get what vaccine and when. Who can we contact if we have not received that information yet?
So I would definitely fill out the form on our website, but Sparrow Carson is receiving Moderna vaccine for hospital employees in Montcalm, and it should be arriving like now or tomorrow. So Sparrow Carson.
Is there a way you can get me a link for where the form is?
I can, yeah. So, oh boy, I don't know your email address. So,
I'll put it in chat.
okay, good. Other questions? That was a good one. Those are the kind of things we need to know where there was a logistical breakdown.
Give us your website address again, please.
Yeah.
Marcus, this is Marie from Caring. I have a question for you. So people that have had people on the priority list then for vaccine also?
Yeah, people on the priority list. Sorry, Marie, you're breaking up.
Is it better?
A little.
Okay, I wanted to know.
Go ahead, Marie.
People that are testing positive for antibodies that have had COVID and recovered, are they lower on the priority list for vaccine?
Little COVID vaccine humor here. I mean, the priority list changed last night, but we have never, ever yet received any guidance that anyone was thinking of taking people who had ever had COVID off the list or putting them down, because there's simply no science that says that they're receiving adequate protection. Also, there's no understanding of the relationship between, natural immunity versus the mRNA vaccine. We don't know. So right now, people who've ever had COVID should just get vaccinated like everyone else.
Thank you.
And I put our website in the chat there, mmdhd.org.
Okay, thank you.
Hi, Marcus, this is Audra.
Hello,
So
Audra.
I have a question. Of course, I'm trying to do all my reading and my research, and there's so much to read. But I have children in their 20s, And of course, most of them work in healthcare, but is it safe for young adults who have, are of the childbearing age and have not had children? Because that's a big kind of, I don't know if it's a myth or, a lot of the readings that I'm doing is a concern.
So there's other medical personnel on here. So I will stumble blindly ahead and you all can jump in and help me if I make a mistake, because Audra, I'm actually, my doctorate is in political science, so it doesn't really help me answer questions like this. There's no results, right? They haven't had a chance to study that. So they don't know about pregnancy or things like that. It's just way too soon. Now, they know that it's safe for the general population to receive the vaccine, and they know it protects the general population. But beyond that, they don't know. And so the advice would be to be cautious and be careful. Also, if something were to happen and someone were to get pregnant, not to freak out, because there's also no evidence that anything bad's going to happen, right? But yeah, they just don't know.
Okay, well, this was my concern because I must have grandchildren someday, Marcus, so.
Yeah.
Thank you.
That's a good question there. Yeah. And it really shows the kind of like where we're really at, what, sort of, we have limited information right now, and that's the reality. All right.
Hi, Marcus. It's Tammy at Montcalm Care Network.
Hi.
Hi, I've been searching your website, but I might as well just ask, where do you foresee our frontline clinicians falling, like a calendar date?
Oh, there's no such thing as a calendar date. I mean,
December, January, February?
Yeah. So we're doing emergency medical now. And then clinicians would start, the Monday after we get back from break. And right now we don't have, names and dates lined up, but that's what we would be doing, starting the Monday after we get back from New Year's. Yep.
And wait till we get an invite or submit a list?
No, please go ahead, and if you want to get vaccinated, fill out that form on our website, submit names, don't wait. That will really help with the research on our part. Yeah.
And we can submit a list of staff names, not just our own?
Yeah, I would ask you to do that, please. Right now, Haley is, as I speak, she's working through lists and trying to, begin to put those invitations together. So anything you send her that can help her do that, I'd appreciate it very much.
All right. We also have nursing staff. If you ever need help, let us know.
Yeah, I think we absolutely will.
All right, great. Thank you.
Marcus, this is Amy Meinhardt. Kind of redundant on Tammy's question, but looking at like Central Montcalm, for example, a lot of staff, this is kind of new information that we're supposed to submit something, the form off the health department, or do you want us to go through another avenue?
No. You don't have to submit anything. There are people who want to submit something.
Okay.
Amy, and that's for them.
Okay.
For the schools, we're going to call you and we're going to set up closed pods. And that should, you're essential workers. And so your personnel should, be right after long-term care. So if things go well, you'll be end of January, right after long-term cares. And so, 7 school districts will be doing 7 closed pods for each of the schools. Yeah, that's
all right. Perfect. Thank you.
You need to go plug it in.
Okay, somebody's not muted.
Well,
so I would like to ask you guys a question now. And so the question of volunteers came up. And one of the things we've been thinking about is how to manage a lot of volunteers, especially volunteers from diverse backgrounds, like nurses in community mental health or first responders. We also have nursing students. We also need people in lots of other roles. And one of the things I was struggling with is making good use of volunteers. And then I had the thought, oh, I can ask the community if someone in organization and agency can volunteer to manage volunteers. How's that thought? I'm looking at my United Ways here and wondering if that, because, you know, yes.
Marcus, it's Terry. Sorry, I'm driving. We are your volunteer center, so just connect with me and we can work on that.
Okay, Terry, absolutely.
Marcus, this is Dean from Capillary United Way, which we cover Clinton County. The 211 call centers is always a good resource to be able to centralize those kind of activities too. And they've been doing a lot of contact tracing, background stuff for the state and things like that. So that may be 211 is a great resource for all kinds of that kind of information.
Yes, I thought of 211. Of course, I thought of Terry last night when I was thinking about asking this question, because I knew she'd unmute herself and volunteer. But with 211, who specifically who would be like the point person where I would say, here's the person I contact who's got my list of volunteers? That's what I don't know.
Okay, in the case of the 3 counties, they're covered by different call centers.
Right.
So we could either use the state association, someone from there to get it, or you could go like the one that covers Clinton County would be Melissa, and I could always connect with that too, or find out how that works. So they have a statewide director that works out of the Michigan Association United Ways for 211.
Yeah.
And he would be a great resource for that. They've done a lot of that stuff already.
Okay, perfect. Thank you.
You're welcome. Thank you.
Marcus, we have a follow-up question from, I think Central Montcalm had asked when schools will be vaccinated. This is coming from Ricky Jensen with MCC. She says, when you say schools, does this just mean K through 12?
No, it does not. It includes all the private schools. It includes special ed. It includes daycare. And you asked about K-12, and so not being a schools person, it's probably obvious to schools people who you didn't mention, who you're referring to, but no. So that would be, and it includes, according to what was on the list that we had last night, it even included child protective services and stuff like that. So
I think she's asking if colleges will be included.
Yeah, I'm specifically asking for the college.
I have not received that guidance that it includes colleges. I have not.
Okay, that's what we think. So I just thought I would check in while we're here.
Yeah. Okay. Any other thoughts? I know that if I let the silence hang, somebody will think of something. But I'm just doing back-to-back calls like this all day long, so a 10-minute break would be welcome by me. Any other thoughts or questions?
Marcus, it's Terry again. I have one quick question. Are our food pantries considered essential, and are they in that line since they're dealing with mass public?
I knew that. I don't remember seeing it on the guidance that I prepared for today, though. So I'll take that as a question, Terry.
Okay.
And since it's been shifted since last night, and since the state will probably ask us what we think, what local public health thinks, I'm assuming you'd like pantries to be considered essential, like shelters.
Well, we have been. I just know that's a big point of contact with a lot of people. For example, our food distribution this week is 1,600 pieces. So that's a lot of people we're in contact with.
Yeah. Okay. I'll pass that up the chain.
Thank you.
Marcus, this is Audra again. So I don't know where our staff lands on this. Should I just fill the form out online?
Yeah. And probably, unfortunately, they're mixed. So you have office workers who can work from home. And so we'll go to the 1Cs, office workers who can work from
Right.
home.
I'm more concerned with the staff
yeah.
that's doing forensic interviews with child abuse victims and.
Oh, yeah. Okay,
So-
so I think, and this is another one I'll pass up, but I would think that that would go in the same bucket as childcare, all of that, child protective, yeah.
Okay. I'll still fill the form out on the page just so you
Yeah.
don't forget us.
Yeah, thank you for that. That's a really good question. And also just, to the extent that at the local level, we have leeway, if we can sneak somebody in, because they meet the spirit of the guidance, even though details are missing, we'll try to do that for you. Yeah.
Thank you.
Hey, Marcus, this is Allison Morrison. I'm just wondering, is there going to be a process, do you know, and I haven't heard this and haven't been on a meeting about it yet, for the CPS workers? Is the state going to generate that information?
Did you say
Child Protective Services workers in the field?
I'm trying to think. So your local health department has received no specific guidance about that.
Okay.
And so what I would expect is that, so it would work one of two ways. Either sometimes in a situation like this, the state sends us a list. Like for our migrant shelters, they sent us a list of migrant shelters. But then sometimes it goes the other way. They say to us, we want you to do this certain population, go find them. And so then we'd reach out to HHS, local HHS offices and say, please send us that list. So it'll, that's not an answer to your question, but those are the two procedures we've seen in different situations, top down or bottom up. But either way, it's assigned either to them or to us. There's an explicit process one way or the other.
Okay, thanks.
And I'm writing.
Marcus, I had to take a call, so stop me if you've already answered this question. Katie Oberski says she noticed when she filled out the form, it didn't ask where she works. How will someone know where I'm at, like what area I'm in?
Oh, I thought it did include that.
I thought it did as well.
Yeah.
That's something we'll take a look at.
Okay.
I actually have it on the screen right now if you guys want me to. It says COVID-19 public vaccine request. If you're interested in being notified, it asks your name, first and last, email address, phone number, and then a question, is your phone capable of receiving text messages, yes or no, and then county of residence.
Okay, so it doesn't have type of business. So if you're trying to advocate for yourself that you're in an eligibility group, that's not in. So we'll fix that, Leslie.
Marcus, I do believe that form was meant for residents, businesses. Actually, now that I'm thinking about it, we're asking businesses, non-residents to just either contact us personally and we'll put you on the list, or you can call the main number at one of our 3 branches and our COVID line will take your name and information.
Okay, so Katie, we'll take a look at that list. I think we can fix it. But otherwise, Leslie's saying call. Okay.
Or you can email me and I can do that, and I'll put my email in the chat.
Okay. Anything else? I've got 10 minutes to my next call. Anything else, folks? Okay, thank you so much. And we'll be doing this again after the new year with updated information. Thanks, folks.
Thank you. Merry Christmas.